All right. Thank you, Vicki. And thank you, Blooming Health, for bringing all of us together today to have some really good conversations about what really matters in the work that we do. And I'm going to kick this panel off just right away, jumping into some statistical information. And just to kind of level set, nationally, 17% or 55.6 million Americans were 65 or older in and according to the 2020 census. That is with an estimated of 10,000 people turning 65 every day. So when we talk about an aging panel, I mean, everybody around us is aging, and it's a blessing to be doing so. So also in 2040, 1 in 5 Americans will be 65 or older. That is a full 22% of the population. Now, nationally, those are, good statistics, but here in Ohio, about 18.8 were 65 and older. So when we bring that into perspective, and I don't know if Abby or Doug will talk about local data, but I always think it's nice to kind of know what are we really talking about. But one thing I know to be true is that this rapidly growing demographic cohort agrees overwhelmingly that they want to age at home. They want to remain at home. So, why are we here today? We're here to talk about how do we make sure that we work together across different sectors to ensure that older Americans, older Ohioans, older individuals in this community can remain independent safely at home. Now, we can't talk about the aging population without also talking about their caregivers. Nearly 1 in 4 adults provided ongoing care for an adult or a child with complex medical conditions or a disability in the past year, an increase of 20 million from 2015 to 2025. Caregiving is a full-time job. Nearly 1 in 4 caregivers have reported providing 40 or more hours of care per week. Now, for more than 50 years, AAAs have served as the local leaders on aging by planning, developing, funding, and implementing local systems of coordinated home and community-based care. I am really excited to be here with Abby and Doug, who are going to talk more about what they do in their local AAAs to serve seniors. So I'm going to ask each of you to take a minute to share how your agencies use Older Americans Act funds to serve consumers.
Okay. Thanks. So there was a discussion earlier about disparities. And for those of you that don't know, Cleveland is, Cuyahoga County is the second poorest county in Ohio. We have the highest concentration of dual eligibles. And what we mean by dual eligibles are people that are qualified both for Medicaid and Medicare in our area. And how we keep up with those dual eligibles has become quite a concentration, not only at the local level, but also at the federal level. We're in the middle of a redesign of the program where they're going to emphasize Medicare more than they emphasize Medicaid, which is what they did for the last 10 years. And for those of you that have any experience in the federal government, I was there for 10 years and I always found really smart people, but they always wanted to do things before you can they always wanted to change things before you can decide whether it worked before. And we had a program called My Care that was dependent upon Medicaid as primary. Now we're going to a program called Next Gen, which will have Medicare as primary. It's a distinction, maybe without a difference, but it's a distinction. And so that's what we're working on now. But the biggest issue we have continues to be how we serve folks in their homes on a daily basis. how we get to the communities. We find that if we can hire people that look like our clients, that we've put a big step forward, and we're trying to concentrate on that on a daily basis. I will put one plug in for us. Mayor Bibb's mother is a social worker for us, and she's been with us for 20 years. So he knows what we do.
So my name is Abby Morgan. I'm the president and CEO of the Area Agency on Aging. In the Akron Canton region, we represent Summit, Stark, Portage, and Wayne counties. Earlier, I was having a conversation with another attendee around how does one find their way to this work? And I am a social worker by background. But my very first volunteer job was actually riding in the back seat while my grandparents were delivering home delivered meals in Toledo. And I remember that distinctly. And I remember my grandmother taking library books out from the local library and delivering them along her route. And I asked her, well, why would she do that? And she said, well, sometimes these are the only conversations that people get to have. And so we like to talk about books whenever we visit with folks. And it really is a privilege to be a part of a network that gets invited into someone's home and sits around the table and is able to have a conversation and a deep understanding of what is it that that person wants for themselves. And most often what you heard from Doug and what you'll hear from Duana and anyone in our network is people want to remain at home. So how are we able to do that, and how do we know what's needed in order to fulfill those goals? And I think that that's what I love about this network, is that we have that ability to assess and understand what those needs are. Our role is to come up with a community needs assessment. I know we've talked about needs assessment, but our role is to look at older adults in our community and do a needs assessment and say, what are the gaps, what are the needs, and how are we allocating resources accordingly? So as an area agency on aging, we have a unique ability to bring stakeholders together to be part of discussions across different sectors to say, this is what we see and this is what the data tells us. We can come up with creative solutions. We understand what services are available, and we can also say, but this is where we can enhance something. This is where we could fill a gap. And so the more conversations that we have around enhancing, filling a gap, and flexibility, those are the spaces where we can be innovative, but also helping people meet their goals.
Thank you, Abby and Doug. And I like to reiterate some of what was said here. Area agencies, for more than 50 years have been innovators, have had a seat at the table. And we are, I think we're one of the networks that have been given opportunities to be innovative. I know some of us are in the space of working with healthcare systems, and we're going to talk about that, working with managed care organizations and other payers, but also finding barriers in the community and being those individuals that can bring the right people to the table and make things happen. Let's just take housing for an example. So in our area agency, it was about 12 years ago, the conversations when the needs assessments would come out and when people would talk about barriers to remaining at home, home was the barrier. People weren't able to find affordable housing. And so our board said, okay, as an area agency, what are we going to do about that? What are we going to do to help solve that problem? And we found ways to be at the table with other people who cared about health at home and serving people in the home and making affordable housing prevalent in our communities. And we could not figure out how that was going to happen in the traditional ways in which that happened. And so we said, let's be part of the solution. We began to talk to our city officials. We said, let's build affordable housing. And I think that's what's really exciting about area agencies on aging and the Older Americans Act in general. It allows us to be creative and innovative. Go ahead, Abby.
Can I add another example
You
to
certainly
that?
can.
So I love hearing examples of where we're looking at the data to say like, okay, well, what can we do in this space? Another thing we learned in one of our needs assessments that we have certain pockets of communities where 60% of respondents were saying that they didn't have any opportunities to interact with anyone from a different generation. And that seems unnatural. But when we think about lives today and busy and most of our lives being lived in our four walls, that can happen very easily. So, but there's this hunger of, well, how are we getting out there? How are we interacting? How am I interacting with someone who's not my age or cohort? And so we looked at, well, where do we see people gathering naturally in the community? And we've had restaurants come to us and say, we have this group of people that come in every week. They love it. We would love to be able to do some kind of programming for them. And so we started a partnership and a diners club with locally owned restaurants to be able to provide flexible meal cards to people that they're getting their nutrition services that is sponsored through the Act, through the Older Americans Act. They're getting access to nutrition. They're getting access to socialization, another goal within the Act, but they're doing it in a way that helps them, again, meet their goals and how they want to receive services and how they want to live their lives.
Thank you, Abby. Go ahead, Doug.
How many of you are confused by how the Older Americans Act is coordinated? Okay, so let's go ahead and talk a little bit about that. The Older Americans Act is one of the Great Society programs of the Kennedy and Johnson administration. You had Medicare, which is probably one of the best healthcare programs of its type in the world. Medicaid pays for long-term care, and then the Older Americans Act. And the Older Americans Act is the only thing that actually makes Medicare and Medicaid more efficient. And so what we do from an organizational perspective is the Older Americans Act created 57 state units on aging. The state unit on aging in Ohio is the Ohio Department of Aging. It created 650 area agencies on aging. Abby covers Akron. We do Cleveland. Duana does Mansfield. So we have 11 area agencies on 12 area agencies on aging in Ohio. As I said, 650 area agencies on aging statewide. But the meat of what we do is at the local provider level, somewhere between 20 and 25,000 local providers nationwide. We are general contractors in that space. We go out and we do the initial assessment, and then we contract with our partners like Benjamin Rose, Lorain County Council on Aging, like the various councils that we work with, that they work with throughout the state. They're boots on the road. They're doing what's necessary every day to make those folks better. Now, many people at the State Unit on Aging, and I worked for 2 state units on aging in my time, will tell you it's all about the state. No, it's all about the boots on the ground, and our providing agencies, the way we look at things has to start with that as primary. So those of you here probably are going to know agencies that are boots on the ground. You can contact us if you ever want to talk to them, and we can help that conversation, but they're the heart and soul of what we do on a daily basis.
Thank you, Doug and Abby, and for that additional context on the Older Americans Act. And it's an amazing piece of legislation that not just benefits the AAAs who administer, but each and every one of us. So let's kind of talk a little bit about how area agencies are able to position themselves in the community locally and work with health systems and payers to bring health home and make sure that we're addressing some of those social determinants of health and leveraging great partnerships. So and either one of you can start out, what are some of the contracts that you have with health systems?
I want to talk a little bit about history and context to where Direction Home is today. So I completely agree with Vicki and Nima. There is something about the work that's being done in Ohio. I think that area agencies on aging and this network is uniquely positioned to kind of bridge the gap that exists between the four walls of healthcare, whether that's a hospital or a physician's office, and then services in the home and community and social services for folks. We have that ability to kind of walk in between that space and help people navigate that gap that may exist between healthcare and social services. And I've seen that particularly strong in Ohio. I started my career in this network in Philadelphia and in DC. And when it came time for me to move back and work at the community local level, I knew Ohio was the network that I wanted to be involved with. And that's continued to be true. There's a lot of opportunities here in Ohio. At Direction Home, that started just with a conversation between our board chair, who's a geriatrician at a local health system, Suma Health in Akron, and our former CEO, talking about what our mutual goals were for our shared patients and shared community members. And we really, the two of them really honed in on that gap of what happens when someone leaves the hospital. That led to us placing our nurse assessors in hospital rooms and talking with patients before they discharge home to say, hey, do you need help at home? Let's get you set up. Let's get you assessed for if there's any potential services that we can help put in place for when you get home. That led to us doing evidence-based intervention around post-acute discharges and reducing readmissions within 30 days. We had a very large demonstration, a CMS demonstration for about 5 years, where we did that evidence-based intervention for 30,000 Medicare beneficiaries over that time period and reduced 30-day readmissions by over 24%. Had a great engagement rate with folks that received that service, and really were able to kind of navigate those outcomes towards then the next phase, which was ultimately working with health plans and payers to say, how do we do this for your Medicare Advantage population? How do we do this for your commercial population that just got out of the hospital? So there was a lot of backstory, but also we had that natural core competency to do that. And it started with that conversation with two leaders to say, how do we make the most of our individual core competencies to make something better together?
I was actually at the state when all this was happening. Abby reminded me yesterday that I was at the state when all this was happening, and it was completely put together by the Akron AAA and Suma. Became a model, as she suggested, statewide. We adopted it with MMO in Cleveland 4 or 5 years ago. 5 years ago. Still, that transition from hospital to home has been essential for most of these clients. And as people continue to say, our folks want to be home. They don't want to be institutionalized. They don't want to stay in a hospital one more day. They want to be home. And programs like this allow for that transition.
Thank you. You know, it is evident that over the past decade, the United States healthcare system has been moving away from volume delivery to a value-based payment approach, placing more emphasis really on quality of care rather than the quantity of care or the quantity of services even provided. This evolution really has created an opportunity for healthcare entities and AAAs to work together. As Abby had indicated, I love to tell this story, and I'm going to give away my age, but I had a hospital stay, and the discharge planner came into my room and was talking about my discharge. And just like Doug indicated, I just wanted to go home. I wanted to be well, but I wanted to go home. And in the process of that discharge, the social worker asked me, I think, 5 questions. Do I have food at home? How do I get my groceries? Do I feel safe? Do I have transportation? And it dawned on me, oh, that's the social determinants of health questions that healthcare systems are asking people over the age of 60. And then it dawned on me, oh, I just turned 60. So that's why they're asking those questions. I was so excited, not about the questions and not the fact that I was 60, but the fact that she asked me, do you work with the local AAA? And I'm like, oh, I don't, oh. And I stopped for a minute and I'm like, well, I work for the Area Agency on Aging. So why are you asking me all these questions? It was a great opportunity. And I was pleasantly surprised that the health system was asking those questions because they had to. But not only that, but they were asking the follow-up question, are you working with the local area agency on aging? And at that moment, it just opened a door for me, right, Vicki? It was great. It opened the door for me to do a follow-up with that particular health system and find out more about what do they do when an individual says, I am food insecure. I do not feel safe at home. I am not working with the area agency on aging. Go ahead, Doug.
Well, you guys have heard me talk about this all the time. It bothers me that we've been doing the social determinants of health since the 80s. And we've been asking this question to everybody that comes through the door of a senior center to try to figure out where they are, what they need, and how we can help them since the 80s. And then it became popular in the healthcare field, and now it's not so popular with us. But in any case, it's the foundation of what needs to be asked to seniors as they transition from a hospital to home, or the transition from home to wherever they're going. It's the central series of questions that we need to ask. And I'm glad that I'm a senior citizen, just in case everybody doesn't know that. And so I get that question when I go to the doctor by everybody I talk to. First of all, I get it from the nurse, and then somebody else comes in and I get it from the next person. Then I get it from the doctor. Then I get it from the discharge planners. And so I answer that question 6 times. Not quite sure why, but I answer it 6 times. But it is the foundation of many of the things that we do on that transition process.
Thank you, Doug. And that is true. AAAs, I've always said that AAAs are experts in social care. And we have been doing it for a very, very long time. But if we're not at the table and if we're not talking about it with our partners or our potential partners, then we're missing huge opportunities to serve the people that are in our communities. So that is really, what we're talking about. Did you want to say something, Abby? Go ahead.
So I'm a social worker, like I said, in some ways disappointment to my father, who wanted me to go to business school, which I ended up ultimately going to business school because it is important in this work to understand the social sides of things, but then what is the cost of providing those social services? And I hear all of these opportunities for being at the table, but sometimes I hear, oh, well, this is something you already do, so we're going to engage you to do it. As an extension of a health plan or a health system or a provider or a healthcare vendor. And sometimes I think we need to think about that difficulty of asking the question and getting the data to where it needs to go. And Doug's example of getting asked that question 5 times, it's because the data is not getting to where it needs to go that it can be used. And I loved Nima's example earlier, the live demo of, and the point really well taken of, we can't keep putting things in different systems, in different IT platforms. The data ultimately needs to follow people. And right now, with the systems that we have, that means time for a staff member to make sure that that data does get used or does get to where it needs to go. That has a cost to it. And I think there needs to be a conversation around the business side of social care, and how do we recognize that, yes, this is work that we've always historically done, but each partner that comes to us to say, you're going to get paid for work that you're already doing, it needs to be enough so that that data can be used and that can follow the outcome that we want to see.
Great segue into my care and how AAAs are working with managed care organizations. And many AAAs in the state of Ohio have been working with managed care for upwards of 15 years. In our area, and I'll just speak to that, and then I'm going to toss it over to Abby and Doug, is when a AAA has been doing certain, aspects of home and community-based services for many years, we do have a strong business acumen. In our area agency on aging, we're not in my care yet, but one of the things that we have really solidified and done well is minor home modification administration and figuring out how to make sure that we can do that in a cost-effective way. And we've been able to build that by working with local contractors and by implementing processes and workflows that do this in a very efficient manner. And we've been able to sell that to managed care organizations. We've been able to do that work for them. And we're a small area agency on aging doing that. But along the way, AAAs have been able to do case management and assessment. And let's talk a little bit about MyCare and the dual integration partnerships and programs that we have. So how did this partnership with managed care organizations
I'll
come
let
to
you
be?
talk first.
And what does it look like?
Well, I just want to tell everybody that when we started MyCare in 2014, I was 40 pounds lighter.
I
And
brought in cookies on the first day.
and it put the
It'll be
40
fun.
pounds on me, but we did figure it out. So go ahead.
So I came to Direction Home in 2014, roughly 6 months before the MyCare demonstration went into effect. And essentially, Doug talked a little bit before, this is a program that is a unique partnership between managed care plans and area agencies on aging. Where the area agencies on aging really are the boots on the ground for the managed care plan to provide that ongoing care coordination for individuals in the community that have long-term services and supports. These are people that are on Medicare and Medicaid and need ongoing service plans, daily services in order to stay home in a more cost-effective, more satisfied way than perhaps staying in a nursing home, but having nursing home level of care, nursing home level of needs. It is a unique partnership that ultimately has stood the test of time. As the program started as a demonstration 10 years ago in, I think, 5 regions of the state, it's now rolling out statewide. And so therefore expanding the role that area agencies on aging have in communities in partnerships with multiple managed care plans to provide that boots on the ground and care coordination efforts. I hope I don't offend any of our healthcare partners in the room, but I keep getting a lot of feedback of, oh, you guys are really sophisticated. Yeah, we've been doing a lot of work in partnership with healthcare and health systems. And I think there's this understanding or there's thought process that community-based organizations don't have an inherent sophistication to them. And I don't care if you are large multi-million-dollar budget or small, you have some level of sophistication if you've navigated multiple funding streams in order to keep your programs going. You have a good sense of what it's going to be and what it's going to take to provide the service. And you figured it out along the way. And so in there is an inherent sophistication that I think there's gaining recognition of for community-based organizations.
So what does that look like? So we go ahead and we do an assessment. The folks at the county do a budget assessment to make sure that these folks qualify for Medicaid. And then we put in place a care plan. To be a caseworker at our organization, you either have to be a RN or a licensed social worker. And what that doesn't do for Abby, but what it does for me, my PhD's in economics, so that's pretty far from what I'm doing on a daily basis. But what it does for me, it provides me an expert that has blessed that person that they're going to get the type of medical care they need to get. And so we go through this process, and now we're talking about the next step, which is boots on the ground. So we call, I'm picking on Benjamin Rose today, but we call Benjamin Rose and say, can you service somebody? They need meals, they need personal care, and they need socialization. And they say whether they can or they can't. Generally, they can. And that starts the process of getting that person better. Hospital discharge, get them home as quickly as possible, and that gets them better. Now, Duana was talking a little bit about housing, and our colleague, Duana's great at it. Our colleague in Toledo was exceptional as well. We have taken a different path. We have decided that we're going to do those minor carpenter jobs, ramps, wider doorways, wider stairs, do those so that they can stay in their home as long as possible. Different way to go about it. Duana's process actually, it's exceptional, proven to be exceptional. We're going to do a little different.
Are we getting to that time?
Well, I wanted to make sure that we had an opportunity for some Q&A, because I think this is an awesome conversation, particularly with this panel. I want to point something out about our moderator, if you didn't notice it, president of the U.S. Aging Board of Directors. And I say that because when I go back to why you guys are so awesome in Cleveland and Ohio, you have national leadership now in aging. So I would like to give a round of applause for the president of the board for U.S. Aging. And I do think in listening to this conversation, it creates an incredible opportunity for you. Because I spend probably 2 weeks, this would be embarrassing to say, 2 weeks out of a month in DC. I sometimes get very depressed. So I've decided I'm always coming to Cleveland. It just kind of makes you feel so much better. But I think it would be awesome if you could share a little bit more about your work as president of the board and some of the leadership that you're able to provide for this great state.
Thank you, Vicki, and thank you for that. I was sworn in at the U.S. Aging Conference in July, but I've been on the board since 2018, first as an alternate, then as a board member, and now very honored to serve as the president of the board.
And we all had to vote on her to be that alternate, but there you go.
You did, didn't you? Thank you very much. I am just honored and humbled to be entrusted with such an important role. And, when I think about the national perspective, my heart will always be right here in Ohio, right here in this region. And when I think about being with my colleagues across the country, I am very proud to represent Ohio and to be an Ohioan, because here in this state, what we've been able to do in the Aging Network with partners like, Benjamin Rose, partners like our senior centers, with the Department of Aging, with, philanthropic organizations, with healthcare systems and payers, we have really led the way. And it is very exciting to have conversations like this. I look forward to being a leader, not just here in the state, but at the national level, and bring the perspective to bring the best, ideas and best practices that have happened in Ohio to that national level, because I think we get it right here. I think when we get it right, it's because we're at the table and we're having conversations like this today. So I envision, one, leading the way in healthcare and in social care, and also leading the way. You talked about the younger generation and the up and comers. I have a passion for leadership, and I have a passion to bring people up and to help them learn and grow in this network. Doug and I have talked about it. We're over the age of 60. We hope to retire someday. And the only way to do that is, one, to set this state up and to set leaders up for success.
My wife and I had that conversation recently, and she told me I can't retire. Nice lady. So I don't know that all of you know, I spent 10, 12 years in Florida. I was director of the Florida Department of Elder Affairs, and there was something missing in the Florida model. And what was missing in the Florida model was the fact that you didn't have the RN and the licensed social worker doing the boots on the ground activities that the AAAs in Ohio do. So that thought that you can get somebody licensed in that space to do those activities, to go ahead and move the client down the road for a better outcome is, I think, central to anything that any state needs to do in that space. And actually, the folks from Akron came down to Florida and told me they'd like me to come back to Ohio, and I did.
Sorry. I agree. It really is what Duana said in the partnerships. There are so many cross-sector partnerships, and that led to my question earlier. I think we hear a lot about duplication of effort. We hear a lot about resource rich and coordination poor. I fundamentally disagree with that. I think you get large change by tackling large issues from multiple different perspectives. And that starts with multiple different stakeholders coming to the table and throwing in all that can be offered. I appreciated the panel's discussion earlier around what is the influence and power that I can bring, and bringing that and putting that on the table along with our other stakeholders, our provider network. We have a significant group of community-based organizations that are our providers who are providing that ongoing care and services in the homes. Folks, partners like Benjamin Rose, partners like Meals on Wheels. It takes all of those efforts and all of those stakeholders in order to make a change.
The other thing I understand is very, very unique, because Doug told me about this, which is you guys educate your elected officials and you invite them to your facilities or to your programs. And if you are not doing it, I strongly recommend it, because it truly, truly makes a difference. That's number one. Number two, that I will add to, because I do this with US Aging, I represent the business community. I go to the Hill with US Aging, because unlikely allies make a difference when you're talking to legislative people. So bring different people, shake it up a little. Don't do your just kind of normal advocacy. Bring people who they care about. Particularly if you have a business in your community, they look at those kinds of issues. And so it's a great effort that differentiates this state. Not every state does that. So congratulations. And I've been told by Jessica, who constantly waves her hand at me, we have maybe room for one or two questions here. Thank you.
I have a mom that's 80. And when we talk about systemic issues, as I listened to you, Doug, about how you were asked 5 times, all those questions, how you were asked those questions, I accompany my mother to many doctor's appointments and hospital stays. And I've never encountered those questions.
Oh, wow.
So when we talk about systemic issues, whether they were intentional or unintentional, probably unintentional, but as a professional, when they see me with my mom, maybe that is a trigger that she has some help or she doesn't need, but she's never asked those questions. The question that she's asked, we were just at a cardiology appointment, is who lives in the home with you? That's a question that we get over and over, but never any coordination of care. So a lot of this is something new that I'm hearing. So I'm wondering, like, is there one place where you can find and navigate these resources? Because I'm having to care for 2 households, which stretches me to capacity because of these, things that I don't even know exist for her.
Good question.
And I find that, or we hear all the time from caregivers who haven't really been introduced to the world of caregiver support, whether they recognize that you are a family caregiver that needs to have support and access to these types of services, but that is you are a target population that the Area Agency on Aging should be supporting, and has resources in order to say, these are the questions that you need to ask, or that can help you at doctor's appointments, or that can put you in contact with other caregivers who are having similar issues and just get some support. But it goes across the gamut, whether it's caregiver support, whether it's respite that's needed, whether it's support for the individual so that you can continue to provide caregiver support to your family member. Making that connection and understanding that caregiver support is a service that is available through the Older Americans Act is, I think, a gap that we need to continue to work on to close.
Yeah, I'll just add to that. I think that's why it's really important that different sectors get together. So like, for instance, when we're talking with health systems, payers, physician offices, and we talk about the role of the Area Agency on Aging, sometimes we just don't talk enough about it. But they, it's those multi-sector people that, when you think about the client's in the center, we all share that same client, patient, whatever we call them in our industry. And we've got to figure out, how do we make sure that we understand, what each system does and how we do it, so that when a caregiver is engaging in a visit with a health provider, that they know and can see those signs and can refer to the Area Agency on Aging.
Eric, let me ask, is there any questions online or in the chat? Hey, come on, guys on chat. Oh, here's a question. I'm gonna start giving out prizes for those who ask them questions. Didn't you the one who turned me down last time? And you're back begging to ask a question? Great timing.
Hi, I'm Seti Chagarvan. I'm one of the providers out of the state in Wisconsin. So to answer your question, actually, the person who asked the question, I, as a provider, didn't know that service exists. And it always happens in the hospital, not in the clinic setting. And the reason for that is, again, the nursing and the social worker, that they are not there. So one thing that I've learned in the last couple of years, that, actually you can consult social worker for the outpatient setting. So I started asking these questions. Can you walk? Who's helping you walking at home? And things like that. So one thing that would be, now that you're lucky to have Blooming Health, I guess, it's important to bring it up as a problem. It's hard for me to take care of my mom at home and have my own family. So, and if all these teams are working together, that would be a beautiful thing, and they will be able to enroll you at this point. So I guess that's the beauty of this getting together and learning about the aging and Blooming Health, and hopefully you get the support that you need.
Thank you.
I would think the other thing that we are constantly talking about is, as an employer, do I know who of my employees are caregivers, and are they getting the support that they need? Are we having conversations with employers and HR departments about caregiving and the impact of caregiving on workforce and productivity? I think we should, so that those gaps don't exist, so people aren't getting the questions that are needed, we need to be proactive in, again, those cross-stakeholder collaborations.
Excellent, excellent. Any last round comments or thoughts?
I need to clear something up a little bit. I've been really bragging about Orion today, but we do we do business with the food bank. The food bank provides our meals in Lake County, in Lorain County, and part of Cuyahoga. So they are a great partner as well. We do business with Medina County Council on Aging, Lorain County Council on Aging. So we are a multi-use organization that tries to work a lot with a lot of our clients.
She's at the speaker table, so she has the right to ask.
They invited me. I'm not a speaker. Your panel started with a comment about 2040 and the statistics and about aging people then. And I was surprised because I've been working on Google. Google is informing my brain about 2030, which is a whole lot closer, and more people will be turning 65 then. So I just wondered what kind of planning your organizations are doing for 5 years from now, not 2040.
You'll have to ask the two of them. I won't be around then, so.
I think that's a great question. I think Abby wants to respond as well, but I think that that is one of the things that AAA's, because of the Older Americans Act, we keep in the forefront of our mind all the time. We're constantly thinking about what is the dynamic shift of the population, and not just the aging population, but the working population, and the younger generation that's going to be taking care of all of us that that turn 60, 65, that find ourselves living alone, wanting to stay at home. But I believe that what is true today will also be true in the future, but the population demographics are going to have to that will change, and we'll have to keep us being innovative and even more creative and more aware of what's happening nationally at the state level and with the people that we're serving and the people that are going to be serving seniors. So I don't know that I really answered your question specifically, but it is our business to know what matters today will also matter in the future, but we may have to shift and be a little bit more innovative with technology, with partnerships, with funding resources.
But from a demographic perspective, we talk about this aging society. It starts to peak in the 2040s. And so what we see in the 2040s may be dramatically different than what we see now, because that aging population will peak, and how we handle that will be a little different than we're handling things now. So that is probably why we brought up 2040.
Because we are area agencies on aging and we are charged with looking at the demographics across the state and within our regions, I know that 25% of my county population is 60 and over right now, not 65, but 60 and over right now. And so we already have gaps. We have waiting lists for services. So knowing the gaps that I have right now, I have to and am looking at, if I can't deliver this service at a scale, I need to start looking at other ways that I can deliver this service in an innovative way with different partners, with technology, with a different focus on how I'm going to meet that person's need. If I can't pay for a personal carry to go into the home, or I can't pay for transportation to a doctor's appointment, I have to be thinking right now about what are the partners that are going to help me meet that need when that scale gets to what it is at 2030 and 2040. And those are the conversations. Those are the partnerships we're actively pursuing. We're talking with entrepreneurs. We're talking with innovation hubs and saying, like, this is the need. This is our area of expertise. This is what we see. How can you collaborate with us to design something that will meet that need at that scale?
Perfect. So I'm going to ask everyone to please thank me for this great panel discussion. You guys were fantastic. Thank you.